Western medicine is very good at fixing parts, but not the whole. Chinese medicine looks at the whole and then the parts. So I graduated from the American College of Traditional Chinese Medicine, ACTCM, in San Francisco, and I immediately opened my own practice inside a brand new gym, Mix, which is beautiful, and they also kind of wanted like this integrative vibe to it. And then I also joined a mixed practice. TCM's claim to fame is backache, right? Back pain. If you have back pain, you can see an acupuncturist. But we do so much more. And really, it's a full-fledged medicine. It's just a different approach to it. So whatever you see your Western doctor for, you can probably see your acupuncturist for as well. You know, of course, like the physical ailments, pulled hamstrings, I've seen a lot of Achilles tendon strain from lots of jumping, shin splints, those kinds of things. See that all the time, tendonitis in the forearm from using your sword and also typing too much. That stuff is obvious to be treated with TCM. It helps with blood flow, it helps create an immune response, so like those chronic injuries, it reawakens the injury signal with the brain, so it goes back in and cleans it up. There's different ways to treat. There's also specializations. I do more orthopedic or sports injury. And then on the other side, somebody like me who is super stressed out and needed a chill pill, there's nothing better than going into acupuncture for that immediate release. On a chemical level, it's an endorphin releaser, and that's your mood booster, stress reducer, and pain reducer. So on a chemical level, you're in a good place to start, and that's just talking on the Western end of the spectrum, not about qi and blood and shen and things like that. There's other modalities than just acupuncture and Chinese medicine. There's also cupping, which is very popular now, gua sha or scraping, or e-stim or TENS machines. We've been doing that, electric stimulation onto the needles. And Tui Na, which is a type of traditional orthopedic massage. And these are all to work on like fascia, joint mobilizations, break up scar tissue. Cupping is really great for pain, sore muscles, increases circulation, creating more tension in the cup. The muscle literally goes up and inside of the cup, so the surrounding tissue basically has to release. The only downside is, you get those marks, but they're kind of fashionable these days, right? Fascia or scraping, similar. It's more, again, fascia-based, trying to increase circulation in the area, making sure that the fascia is like, if you see a steak and you see that white sheen on it that you can't quite eat, that's fascia. It's just like a protective layer, so like carpal tunnel, that's also fascia. And if you have a lot of inflammation, old injuries in that area, it gets gunky and it doesn't quite slide as it needs to. And so doing like the scraping helps to break it up and make sure that it's sliding more smoothly again. I mean, ultimately, I like the theory of TCM. Pay attention to the roots and the branches. It's not just paying attention to the piece. And looking at the mind-body connection is really important. And the Western world is starting to catch up to that very much so, like thinking about how many nerve endings we have in the gut, right? And how depression or many injuries or conditions are related to the gut, in fact. Well, TCM, everything starts from the center. We've been saying that for eons. This is not news to us. If you want an acupuncturist, make sure they're an acupuncturist. That's what I have to say first and foremost. An acupuncturist has had over 4 years, thousands and thousands of hours of training. And we are very trained on what is safe and is not safe. Second of all, if you want to do more like an orthopedic treatment, you ask that question, hey, what do you specialize in? Because most acupuncturists have a specialization. Do you specialize in sports injuries or general wellness? So those are very different practices. You just have to commit to treatment, which is really hard, I think, for Westerners. We're so ingrained that doctors fix us, much like the mechanic in the car. And Chinese medicine is a wellness medicine. So ideally, you're seeing us on a regular basis so you don't get to the point where your part is broken. But that's just not the reality culturally here. So we do what we can, right?